just make it loose. Okay, बॉडी को जितना हम रिलैक्स रखेंगे उतना बेटर है. Just make it loose. So first we'll correct your leg length. राइट शोल्डर में पेन है ज़्यादा, राइट साइड. लिफ्ट करके एक बार लिफ्ट करके देखिए ज़रा, दोनों पीछे की तरफ कितना जा रहा है.
चला पूरा जाएगा.
रेंज ऑफ मोशन, फ्लेक्सिबिलिटी इज ओके.
Flexibility is fine, but just the pain and
discomfort is there. Discomfort is there. Okay. So can you put your both hand backside of neck and close this? Yes. Bend your both knees. Close this like this. Yes. Better. Grip आपकी better होनी चाहिए. Hand grip. It's okay. Go down. Go down. Stiff hand. Yes. Yes. Relax. Breath in and out. Breath in and out. Make it straight. This one. Lose your shoulder. Tenderness.
yes.
Both.
Moreover, I can
More
feel it here.
mid back. Okay. Make it loose. Okay, straight this one. This is okay. Just make it loose. Use your body as much as possible. This is the tender point here. Down also, or here. Here. More. Huh? Okay. Just make it loose. Just turn one side, get up and walk few steps. फ्री होके थोड़ा सा बॉडी को रिलैक्स रखना है, क्योंकि जब आप रिलैक्स वॉक करेंगे तो मैं लेग लेंथ मेजर कर पाऊंगा इजीली.
I'm just trying to put my focus on the shoulder so that it would go like this.
हाँ, so just walk like this, freely. Move your shoulder as well. How you feel? Discomfort.
Here.
Yeah, exactly.
Here.
At center. Huh?
Center or more likely towards
right
right
side.
side.
Right side. Understood. Head this way. Head this way. So first we'll do the alignment, then we'll release the structures.
Okay.
Okay? All the tight structure. Just relax. Breathe in and out. Loose. See, your flexibility is good, but still you have stiffness.
I have a lot of stiffness.
Make it loose. This side is little tight. Little more. Loose, make it. Yes. ये थोड़ा सा open up करना जरूरी था. ये tight है. Side muscles. Because क्योंकि आप क्या कर रहे हैं, चिन ना प्रोट्रूड कर रहे हैं आगे की तरफ ज़्यादा. ये चिन ज़्यादा आगे है ना. ये कहाँ होना चाहिए? Again, turn one side, get up and walk.
I have this
Hump.
hump.
In the cervical, yes.
Yes.
So mostly, I'll tell you why people are having hump. Just because of the poor posture. One thing. Another thing is mid back is slouch.
Yes.
Okay. Rounded shoulder
Yes.
and forwarded it.
So this has to be like this.
Yes, posture should be like this. So only 20% fat. Okay. 80% just because of the poor posture. Poor posture means rounded shoulder forward. If you work like this, after 1 month, I easily can get this hump. Everyone can get hump because that area is not moving. They are not doing much exercise for that area also. We are not doing this. We are not doing this. Okay. So होता क्या है? All the fat accumulated at one point. Weak muscles, like weak muscles, fat. Weak muscles, fat. यहाँ पे double chin, fat. बैठिए. बैठना है, सिटिंग पोजीशन में आएंगे. थोड़ा सा आगे की तरफ, क्वाड फॉर्म. Yes, that's it. Your foot should be, at full contact with the ground.
I do take good diet, but I repeatedly gain weight. That is one of the problems.
With multivitamin, you can't stop your weight.
Is it
Then
all
you-
because of the vitamin D and the B12?
Yes, you can't. See, if there's a lot of patients, they are coming, they are telling her, I have history of multivitamins. But and then there is the next statement here, weight कैसे reduce करें? How it is possible? You are continuously taking multivitamins and you are not burning that thing. Like if I am taking protein and I will not do workout, then what protein will do? Uric acid will increase, your joint pain will increase. Okay? So everything, जो भी body में जा रहा है, that should be burn out. चाहे वो carbs है, चाहे वो protein है ना? तो अगर burn नहीं करेगा तो problem होगा.
I do workouts as well for good strength, strength training and everything. I take proteins and everything, but still I face issue while losing weight.
Okay.
I mean, how easily I gain weight, I definitely
Because you are
can't.
happy from inside. That's it. एक बार again, try. ना जैसा force उधर लगाया same. Do it. That's it. Just get up and walk again.
I could feel better in my shoulders.
थोड़ा
Honestly.
light लग रहा होगा.
Lot. What happens on daily basis after the session for an hour or two, I feel very light.
Okay.
But by the end of the evening,
Mhm.
everything starts coming.
So इसका best solution क्या है पता है? Your session should be at 6:30
In the evening,
in the evening
I'm
because.
so sorry, I wish, but I have my shift on until 11.
Okay, no problem. But see, if patient are keep telling like this, यार I morning से तो everything is okay, afternoon भी ठीक रहता है, and वो evening में आके फिर से बढ़ जाता है. That means somehow we can't maintain the posture. Okay, so जो हमारा postural muscle है, वो क्या हो रहा है? एक initial 1 hour, 2 hour is okay. जैसे ही वो 3 hour, 4 hour, जैसे ही 5 hour टाइम निकलता है आगे, so you are starting work like this, 1 hour, 2 hour, 3 hour, 4 hour. So at the end of the day is like वो फिर वो पेन आ जाता है, ठीक है? So उसका तरीका क्या है? या तो हम इसको ब्रेक करें, जैसे आप एक्टिविटीज़ को ब्रेक कर सकते हैं, 30 मिनट में उठ के चल सकते हैं, सब कर सकते हैं. लेकिन अगर ये पेन का पैटर्न ऐसा ही है लास्ट 3 days से सेम पैटर्न, इसका मतलब क्या है कि उस प्रॉब्लम को हमें आफ्टर 5 हिट करना पड़ेगा, क्योंकि प्रॉब्लम ही एंड में आ रहा है. मॉर्निंग तो फिर भी हमारी एनर्जेटिक निकल रही है, ठीक है? तो जब तक हम मसल को स्ट्रेंथन नहीं करेंगे, जो हमारी पॉस्चरल मसल है, तब तक ये प्रॉब्लम रिपीट होती रहेगी. तो इसके लिए हमें थोड़ा सा देखिए, मैं नहीं कह रहा हूँ बहुत सारी चीज़ें, लॉट ऑफ थिंग्स, हमें कंफ्यूज नहीं होना है. 1 by 1 हम चलेंगे. हमारा D है, हमारा B12 है, हमें स्टमक पे काम करना है, हमें लाइफ स्टाइल को बैलेंस करना पड़ेगा. अगर हम वो बैलेंस नहीं कर पाएंगे तो हम इस पेन को या इस पेन को या इस पेन को, वो पेन तो रहेगा वहीं का वहीं फिर, है ना? तो थोड़ा सा हमें टाइम मैनेजमेंट पे आना पड़ेगा, ठीक है? एंड अपार्ट फ्रॉम दैट यू शुड हैप्पी फ्रॉम इनसाइड, सबसे इम्पोर्टेंट. आई होप यू आर ओके. Just lie down, face up. हाँ? क्या? ऊपर? नहीं. Relax. So now I'll check your stomach. Okay? Just make it loose. Painful. ये ठीक है?
That one was more
More, because that means upper body weight is more concentrating on this side also.
left.
Weight आ रहा है, ठीक है?
My ankle hurt a lot.
Okay. So is there any history of ankle twist and all? No. Okay.
I used to have a in between before 6 months around. I was having severe pain in my left ankle.
Left ankle only.
And even if I walk for good 20 minutes or so, I start getting the
So
pain.
ankle or heel?
Ankle.
Ankle only. So there's no
That-
history of this ankle twist and all. हाई हील्स वगैरह तो नहीं डाला, पार्टी में गए वहाँ पे पैर मुड़ गया, याद नहीं रहा ऐसे करके नहीं.
But ऐसा नहीं है कि I have to go to the doctor
Okay.
to get it fixed. ऐसा कभी नहीं हुआ, never happened. But when I walk, I get this pain every time.
Okay. So frequently shoes वगैरह footwear change करते रहते हैं. Is there any history? उसकी वजह से भी हो सकता है. I'm not telling कि उसी की वजह से है, but it can be the chances. Like suddenly if you start any activity like जैसे हम walk कर रहे हैं, okay, हमने प्लान किया यार कल से walk करना है, तो you will get pain. You can get pain. Okay. Walk, brisk walk over hard surface every day with different shoes.
No, shoes remain same.
Remain same.
Sport shoes remain same, but it's only happen when it's in left leg,
Left leg.
not in right leg,
Not in right.
only in leg,
Only.
left one.
Okay. Water intake is okay ना? Water intake की
Water
side से
intake
तो
is-
कोई problem नहीं है. ठीक है.
Also in calf sometimes, but in left only,
Left.
not in right.
Okay. Bend this knee. Bend. So now what you will do? Just bend your knee and make it straight. Just do this repeated activity. Okay. So I'll release few muscles. Okay. Yeah. Do it. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So it will be a little painful. Okay. So now what you will do? Just bend your knee and touch this. Okay. So every time when your shoulder will go this in this direction, your leg should be straight. Yeah. Do it. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Relax. Breathe in and out.
I could feel pain in my ankle.
Ankle also. See, because of this soft tissue tightness. Okay. Do it. 1, 2. This side is more tight. 3, 4, 5, 6, 7, 8, 9, 10. Relax.
My navel display is this side only.
That's why, because you have a lot of tightness this side, and if you do this movement again, will do that, you will get more symptoms on this side, because this side is soft tissue is always like this. Okay, so it happens just because if you have tightness in one area, you will feel the stretch here also. Okay, concentrating on one area, but that is creating pressure all over the things.
Food related.
Yeah, do it again. The same thing. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Relax. Breathe in and out. Now bend your both knees. Just bend your both knees. Yes. Only breath in and out. Nothing else. Okay. Just breath in, out. Breath in, out. Breath in, out. Breath in, out. Your exhale should be prolonged. Yes. Yeah, do it. Yes, yeah, do it. Yes. ये थोड़ा सा ज़्यादा होगा पेन. Okay, just 2 minutes. Let's do it. Relax. Breathe in and out. This will be less pain as compared to that side because tightness is less here. Okay, breath in, out. This side is soften. Okay. Yeah, do it. Good. This is little tender here. Yeah, do it again. This is also tender. So this portion, both the sides. Do it. Do it. Do it. Do it. Just relax. Just relax. Can you make straight your knee? Yes. Breath in, out. Bend again. Bend your both knees. Yeah. Make it straight. Breath in and out. Make it loose. ये नहीं हुआ था क्यों? क्योंकि you have stiffness more on this side, so it's like this. Okay. Breath in and out. Breath in and out. Just turn one side, get up and walk. Walk again. Walk again. Walk and tell me, like, how much relief you have, how you feel right now.
Except this portion, I have most of my body parts are
Released. Okay. So this portion is little still tight. Okay. So that will create little screamy, like, because the tightness is more. Whenever I'll release, that will be little painful. Okay. But I'll release. Don't worry. Okay. Just lie down. Just lie down. So above this umbilicus, that navel, this area is little loose enough.
Yes,
This.
yes, it has.
And it, whenever it will lose, that will also give relief in the back also. Because if you have constipation and acidity more, that will create back pressure over spine. That's why there's a lot of people are feeling that pain is going down also, just because of the acidity. Okay?
So there's something for acidity and constipation also.
Okay. This is little better.
Much better.
यहाँ तो था ही नहीं, ठीक है. Just make it loose. Bend your knee. Breath in, out. Yeah. Breath in, out. Breath in, out. Breath in, out. Make your knee straight. Okay. Straight. Breath in, out.